Hello, future healthcare heroes, and welcome back to the channel. Today, we are focusing on the endocrine system, one of the most important systems in the human body. We will cover 30 key multiple-choice questions to help you understand hormone functions, gland roles, and how this system affects overall health. Whether you are preparing for the NCLEX or reviewing for class, this video will strengthen your knowledge and boost your confidence. Subscribe, turn on notifications, and let's get started. 1. Which gland produces hormones that regulate metabolism, heart rate, and body temperature? A. Adrenal gland. B. Thyroid gland. C. Pituitary gland. D. Pancreas. Answer B. Thyroid gland. Rationale: the thyroid gland produces thyroid hormones, T3 and T4, which regulate metabolism, heart rate, and body temperature. A. The adrenal gland produces hormones like cortisol and aldosterone, which manage stress and fluid balance. C. The pituitary gland regulates other glands, but does not directly control metabolism. D. The pancreas regulates blood glucose via insulin and glucagon. 2. A patient with low antidiuretic hormone ADH levels is likely to develop which condition? A. Syndrome of inappropriate ADH secretion. B. Diabetes insipidus. C. Cushing syndrome. D. Hyperthyroidism. Answer B. Diabetes insipidus. Rationale: low ADH levels impair water reabsorption in the kidneys, leading to diabetes insipidus, characterized by excessive urination and thirst. A. Side involves excess ADH. C. Cushing syndrome is related to excess cortisol. D. Hyperthyroidism is caused by excess thyroid hormones, not ADH. 3. Which hormone is primarily responsible for increasing blood calcium levels? A. Calcitonin. B. Parathyroid hormone. C. Cortisol. D. Insulin. Answer B. Parathyroid hormone. Rationale: parathyroid hormone, PTH, produced by the parathyroid glands, increases blood calcium by stimulating bone resorption and renal calcium reabsorption. A. Calcitonin lowers blood calcium. C. Cortisol regulates stress and metabolism, not calcium. D. Insulin regulates blood glucose. 4. A patient with elevated cortisol levels is at risk for which condition? A. Addison's disease. B. Cushing syndrome. C. Hypothyroidism. D. Diabetes mellitus. Answer B. Cushing syndrome. Rationale: elevated cortisol levels cause Cushing syndrome, characterized by weight gain, hypertension, and hyperglycemia. A. Addison's disease results from low cortisol. C. Hypothyroidism involves low thyroid hormones. D. Diabetes mellitus is related to insulin dysfunction, not cortisol. 5. What is the primary function of insulin in the body? A. Increase blood glucose levels. B. Decrease blood glucose levels. C. Stimulate bone growth. D. Regulate sodium excretion. Answer B. Decrease blood glucose levels. Rationale: insulin, produced by the pancreas, lowers blood glucose by facilitating glucose uptake into cells. A. Glucagon increases blood glucose. C. Growth hormone stimulates bone growth. D. Aldosterone regulates sodium excretion. 6. Which gland is known as the master gland due to its control over other endocrine glands? A. Thyroid gland. B. Adrenal gland. C. Pituitary gland. D. Pancreas. Answer C. Pituitary gland. Rationale: the pituitary gland produces hormones like ACTH, TSH, and FSH that regulate other endocrine glands, earning it the title master gland. A. The thyroid regulates metabolism. B. The adrenal gland manages stress and electrolytes. D. The pancreas regulates blood glucose. 7. A patient with hyperthyroidism is likely to exhibit which symptom? A. Weight gain. B. Bradycardia. C. Heat intolerance. D. Lethargy. Answer C. Heat intolerance. Rationale: hyperthyroidism, caused by excess thyroid hormones, increases metabolism, leading to heat intolerance. A. Weight gain is associated with hypothyroidism. B. Bradycardia is seen in hypothyroidism. D. Lethargy is not typical. Hypothyroidism causes restlessness. 8. Which laboratory value is most critical to monitor in a patient with suspected hypothyroidism? A. Serum cortisol. B. Thyroid-stimulating hormone. C. Blood glucose. D. Serum sodium. Answer B. Thyroid-stimulating hormone. Rationale: thyroid-stimulating hormone, TSH, levels are elevated in hypothyroidism due to decreased thyroid hormone production, making it the most critical value to monitor. A. Cortisol is unrelated to hypothyroidism. C. Blood glucose is not specific. D. Sodium levels are not primarily affected. 9. A patient with diabetes mellitus has a blood glucose level of 350 milligrams per deciliter. What is the nurse's priority action? A. Administer insulin. B. Encourage fluid intake. C. Restrict carbohydrates. D. Monitor blood pressure. Answer: A. Administer insulin. Rationale: a blood glucose level of 350 milligrams per deciliter indicates hyperglycemia, requiring insulin to lower glucose levels. B. Fluid intake is important but not the priority. C. Carbohydrate restriction is a long-term strategy. D. Blood pressure monitoring is not the immediate priority. 10. Which hormone regulates the body's response to stress and inflammation? A. Insulin. B. Cortisol. C. Calcitonin. D. Oxytocin. Answer: B. Cortisol. Rationale: cortisol, produced by the adrenal cortex, regulates stress response and inflammation. A. Insulin manages blood glucose. C. Calcitonin regulates calcium. D. Oxytocin is involved in labor and bonding. 11. A patient with Addison's disease is at risk for which electrolyte imbalance? A. Hyperkalemia. B. Hypokalemia. C. Hypercalcemia. D. Hyponatremia. Answer: A. Hyperkalemia. Rationale: Addison's disease involves low cortisol and aldosterone, leading to reduced potassium excretion and hyperkalemia. B. Hypokalemia is seen in excess aldosterone. C. Hypercalcemia is unrelated. D. Hyponatremia may occur but is less critical than hyperkalemia. 12. Which type of feedback mechanism primarily controls the production of thyroid hormones? A. Positive feedback. B. Negative feedback. C. Neural feedback. D. Autocrine feedback. Answer: B. Negative feedback. Rationale: the production of thyroid hormones is mainly regulated through a negative feedback mechanism. When levels of thyroid hormones, such as triiodothyronine, T3, and thyroxine, T4, become elevated in the bloodstream, they signal the pituitary gland to reduce the release of thyroid-stimulating hormone, TSH. This decrease in TSH then reduces thyroid hormone production, maintaining hormonal balance. Positive feedback loops are uncommon in the endocrine system and usually involve events like childbirth. Neural feedback involves the nervous system but is not the primary regulator of thyroid hormones. Autocrine feedback refers to cells responding to substances they themselves secrete, which is not applicable in this context. 13. A patient with diabetes insipidus is likely to exhibit which symptom? A. Weight gain. B. Polyuria. C. Hypoglycemia. D. Hypertension. Answer: B. Polyuria. Rationale: diabetes insipidus, caused by low ADH, leads to excessive water loss and polyuria. A. Weight gain is not typical. C. Hypoglycemia is unrelated. D. Hypertension is not a primary symptom. 14. Which gland secretes melatonin to regulate sleep-wake cycles? A. Pituitary gland. B. Pineal gland. C. Thyroid gland. D. Adrenal gland. Answer: B. Pineal gland. Rationale: the pineal gland secretes melatonin, which regulates circadian rhythms. A. The pituitary regulates other glands. C. The thyroid controls metabolism. D. The adrenal gland manages stress and electrolytes. 15. A patient with suspected hyperparathyroidism should be monitored for which condition? A. Hypocalcemia. B. Hypercalcemia. C. Hypoglycemia. D. Hypernatremia. Answer: B. Hypercalcemia. Rationale: hyperparathyroidism involves excess PTH, leading to increased blood calcium, hypercalcemia. A. Hypocalcemia is seen in hypoparathyroidism. C. Hypoglycemia is unrelated. D. Hypernatremia is not a primary concern. 15. A patient with suspected hyperparathyroidism should be monitored for which condition? A. Hypocalcemia. B. Hypercalcemia. C. Hypoglycemia. D. Hypernatremia. Answer: B. Hypercalcemia. Rationale: hyperparathyroidism involves excess PTH, leading to increased blood calcium, hypercalcemia. A. Hypocalcemia is seen in hypoparathyroidism. C. Hypoglycemia is unrelated. D. Hypernatremia is not a primary concern. 15. A patient with suspected hyperparathyroidism should be monitored for which condition? A. Hypocalcemia. B. Hypercalcemia. C. Hypoglycemia. D. Hypernatremia. Answer: B. Hypercalcemia. Rationale: hyperparathyroidism involves excess PTH, leading to increased blood calcium, hypercalcemia. A. Hypocalcemia is seen in hypoparathyroidism. C. Hypoglycemia is unrelated. D. Hypernatremia is not a primary concern. 16. Which hormone stimulates red blood cell production? A. Erythropoietin. B. Aldosterone. C. Growth hormone. D. ACTH. Answer: A. Erythropoietin. Rationale: erythropoietin, produced by the kidneys, stimulates red blood cell production in response to low oxygen levels. B. Aldosterone regulates sodium. C. Growth hormone promotes growth. D. ACTH stimulates cortisol production. 17. A patient with Cushing's syndrome is at risk for which complication? A. Hypotension. B. Osteoporosis. C. Hypoglycemia. D. Weight loss. Answer: B. Osteoporosis. Rationale: Cushing's syndrome, caused by excess cortisol, leads to bone loss and osteoporosis due to decreased bone formation. A. Hypertension is more common. C. Hyperglycemia is typical. D. Weight gain, not loss, occurs. 18. What is the nurse's priority teaching for a patient newly diagnosed with type 1 diabetes? A. Avoid all carbohydrates. B. Monitor blood glucose regularly. C. Restrict fluid intake. D. Limit physical activity. Answer: B. Monitor blood glucose regularly. Rationale: regular blood glucose monitoring is essential for managing type 1 diabetes to prevent complications. A. Carbohydrates should be balanced, not avoided. C. Fluid restriction is not indicated. D. Physical activity is encouraged with proper glucose management. 19. Which hormone is responsible for uterine contractions during labor? A. Oxytocin. B. Prolactin. C. Estrogen. D. Progesterone. Answer: A. Oxytocin. Rationale: oxytocin, produced by the posterior pituitary, stimulates uterine contractions during labor. B. Prolactin promotes lactation. C. Estrogen supports reproductive development. D. Progesterone maintains pregnancy. 20. A patient with hypothyroidism reports constipation. What is the nurse's best response? A. Increase fiber intake. B. Restrict fluid intake. C. Avoid exercise. D. Take a diuretic. Answer: A. Increase fiber intake. Rationale: hypothyroidism slows metabolism, causing constipation. Increasing fiber intake promotes bowel motility. B. Fluid restriction worsens constipation. C. Exercise helps, not harms. D. Diuretics are not indicated for constipation. 21. Which gland regulates blood pressure through aldosterone production? A. Thyroid gland. B. Adrenal gland. C. Pituitary gland. D. Pancreas. Answer: B. Adrenal gland. Rationale: the adrenal cortex produces aldosterone, which regulates blood pressure by controlling sodium and water retention. A. The thyroid regulates metabolism. C. The pituitary controls other glands. D. The pancreas manages glucose. 22. A patient with SIAD is at risk for which electrolyte imbalance? A. Hyperkalemia. B. Hyponatremia. C. Hypercalcemia. D. Hypomagnesemia. Answer: B. Hyponatremia. Rationale: SIAD causes excessive water retention, diluting sodium and leading to hyponatremia. A. Hyperkalemia is not typical. C. Hypercalcemia is unrelated. D. Hypomagnesemia is not a primary concern. 23. Which hormone promotes growth in children? A. Insulin. B. Growth hormone. C. Calcitonin. D. Aldosterone. Answer: B. Growth hormone. Rationale: growth hormone, produced by the anterior pituitary, promotes growth in bones and tissues in children. A. Insulin regulates glucose. C. Calcitonin lowers calcium. D. Aldosterone manages electrolytes. 24. A patient has a thyroid-stimulating hormone, TSH, level of 0.2 milliunits per liter. This finding is most likely associated with which condition? A. Underactive thyroid, hypothyroidism. B. Overactive thyroid, hyperthyroidism. C. Diabetes mellitus. D. Addison's disease. Answer: B. Overactive thyroid, hyperthyroidism. Rationale: a TSH level of 0.2 milliunits per liter is below the normal range and typically indicates an overactive thyroid gland or hyperthyroidism. When thyroid hormone levels are high in the blood, they suppress the release of TSH from the pituitary gland through a negative feedback mechanism. In contrast, an underactive thyroid, hypothyroidism, usually causes an elevated TSH level due to the body's attempt to stimulate more thyroid hormone production. Diabetes mellitus primarily involves insulin and blood glucose regulation, not thyroid hormones. Addison's disease affects the adrenal glands and cortisol levels, not TSH. 25. Which organ produces glucagon to increase blood glucose levels? A. Liver. B. Pancreas. C. Thyroid. D. Adrenal gland. Answer: B. Pancreas. Rationale: the pancreas produces glucagon in alpha cells to raise blood glucose by stimulating glycogenolysis. A. The liver responds to glucagon. C. The thyroid regulates metabolism. D. The adrenal gland produces cortisol and aldosterone. 26. A patient with adrenal insufficiency reports fatigue and hypotension. What should the nurse monitor? A. Serum cortisol levels. B. Blood glucose levels. C. Serum calcium levels. D. Thyroid hormone levels. Answer: A. Serum cortisol levels. Rationale: adrenal insufficiency, e.g., Addison's disease, involves low cortisol, causing fatigue and hypotension. Monitoring cortisol levels is critical. B. Glucose may be low but is secondary. C. Calcium is not primarily affected. D. Thyroid levels are unrelated. 27. Which hormone is critical for lactation after childbirth? A. Oxytocin. B. Prolactin. C. Estrogen. D. Progesterone. Answer: B. Prolactin. Rationale: prolactin, produced by the anterior pituitary, stimulates milk production for lactation. A. Oxytocin aids milk ejection. C. Estrogen supports reproductive development. D. Progesterone maintains pregnancy but inhibits lactation. 28. A patient with hyperthyroidism reports palpitations. What is the nurse's priority action? A. Administer beta blockers. B. Restrict fluid intake. C. Encourage rest. D. Administer thyroid hormone. Answer: A. Administer beta blockers. Rationale: palpitations and hyperthyroidism result from increased metabolism and heart rate. Beta blockers are prescribed to manage these symptoms. B. Fluid restriction is not indicated. C. Rest is helpful but not the priority. D. Thyroid hormone worsens hyperthyroidism. 29. Which system is most affected by thyroid hormone imbalances? A. Cardiovascular system. B. Musculoskeletal system. C. Integumentary system. D. Urinary system. Answer: A. Cardiovascular system. Rationale: thyroid hormones significantly affect heart rate and cardiac output, making the cardiovascular system most impacted by imbalances. B. Musculoskeletal effects are secondary. C. Skin changes occur but are less critical. D. Urinary system is minimally affected. 30. A patient with diabetes mellitus is at risk for which complication due to insulin deficiency? A. Hypoglycemia. B. Hyperglycemia. C. Hypokalemia. D. Hypernatremia. Answer: B. Hyperglycemia. Rationale: insulin deficiency in diabetes mellitus prevents glucose uptake, leading to hyperglycemia. A. Hypoglycemia results from excess insulin. C. Hypokalemia is not directly related. D. Hypernatremia is not a primary concern.